I'm Rihanna Sturgeon. I'm a Master's of Athletic Training student from Texas Lutheran University. I read an article on short-term effects of high-intensity laser therapy versus ultrasound therapy in the treatment of people with subacromial impingement syndrome, a randomized clinical trial. So a little bit of background. Subacromial impingement is a painful syndrome that is caused by entrapment of an anatomical structure between the anterior inferior corner of the acromion and the greater tuberosity of the humerus. So the purpose of this study is to evaluate short-term effectiveness of high-intensity laser therapy versus ultrasound therapy in the treatment for subacromial impingement syndrome. So the methods, it was 70 participants. They were ranged around the age of 50s, and it was conducted in a hospital setting with instructors who had at least 6 years of experience with the modalities that were used. There was 10 treatments for either the high-intensity laser therapy or the ultrasound therapy. Each controlled group received 10 treatments, and for the ultrasound group, they received 10 minutes, 10 different times, at a measurement of, or frequency, of 1 millimeters of mercury, and the cycle was a duty cycle of 100%. The physician moved the transducer in a circular motion about 20 centimeters total, ranging from the superior to the anterior portion of the shoulder. The high-intensity laser treatment lasted about 10 minutes as well, and with that they used the highest wavelength and the maximum energy impulse of 150 milliliters. The measurements were the constant Murray scale, the visual analog scale, and the simple shoulder test. These three were measurements used with both the high-intensity laser treatment and the ultrasound treatment. The results showed that the visual analog scale was the only clinically important difference between the three different surveys. It also showed that high-intensity laser treatment showed a greater decrease in pain with the patients versus the ultrasound treatment. In conclusion, patients with subacromial impingement syndrome showed a greater reduction with high-intensity laser treatment. They also showed improvement in their functionality, muscle strength of the shoulder affected just after 10 treatments, again with the high-intensity laser treatment versus the ultrasound. So the use of ultrasound I would not use, based off of just this one study, because it showed that ultrasound was not clinically significant, and it also showed that there are obviously better treatments out there than just solely ultrasound. Critiques and future studies, sample size, so maybe increasing the sample size to more than just 70 participants, and then also it was kind of hard because there was no control group. I think in future studies maybe having a control group versus ultrasound instead of having like 2 different modalities. And then I also think maybe even following up with our patients after 2 weeks to see more of a long-term effect. And that's my site.